This is Dr. Zach Pharr with Tennessee Orthopedic Alliance out of Nashville, Tennessee, presenting the SafeCut Capsulotomy blade, one of the latest advances in safe access regarding hip arthroscopy. As we know, the number of hip arthroscopy procedures being performed has grown immensely in recent decades, providing excellent treatment for our patients who historically did not have great options. However, hip arthroscopy is often described as one of the more difficult procedures in orthopedics. It has a steep learning curve, and minor complications have been seen, which are primarily related to increased traction time and iatrogenic chondrolateral damage. It is agreed that these iatrogenic injuries can be minimized with surgeon experience, but additionally with continued improvements in instrumentation. The FlushFit Cannula system, along with the SafeCut Capsulotomy blade, are two monumental advances when it comes to safe access. The SafeCut Capsulotomy blade is a 4mm one-piece construction that combines a blunt tip for cartilage protection along with a blade that is uniquely designed for cutting through hip capsule tissue. Its working length is hip-specific at 220mm, and it comes in both straight and curved options depending on surgeon preference. In addition, it can be used with or without an ergonomic handle for ease of use. My preference is the non-handled version, which can simultaneously be used as a switching stick, eliminating multiple extra steps in traditional capsulotomy creation. Here we are performing hip arthroscopy on the right hip. We've got our anterolateral portal and our mid-anterior portal created. Currently we are viewing through the mid-anterior portal and looking back at our anterolateral portal. We're now going to start performing our interportal capsulotomy. Here we're going to show the new SafeCut Capsulotomy blade. And now we can remove our cannula safely with the blunt tip in the joint that protects the cartilage. And now we are ready to perform our interportal capsulotomy. We can make this as minimal or as extensive as we'd like. We're going to extend this, touch posterior lateral, and now back towards our mid-anterior portal to start our interportal capsulotomy. You'll notice that the blunt tip is protective throughout the capsulotomy cut. Here, if you'll take my FlushFit Cannula back, and we'll switch now back to the mid-anterior portal to complete our interportal capsulotomy. Go ahead and take out our SafeCut Capsulotomy blade. We're going to now switch viewing portals to our anterolateral portal. And we're utilizing the new Panoscope for this. Right now we have it on Panoscope. We can also switch it to a traditional 70 if we'd like, or a traditional 30. For this case we're using the Panoscope version. And so now we're ready to easily finish off our interportal capsulotomy with minimal steps, which again is decreasing our traction time and helping out with our OR efficiency. Our blunt tip here is just shown on the femoral head, protecting that femoral head. And any kind of oscillation that's required has an extra fail-safe there. And we're now finishing off our interportal capsulotomy. If we'd like to take it further this way, we can. And that makes a nice, clean, and quick interportal capsulotomy. Now we're starting to get better visualization, and we can start moving forward with our hip arthroscopic labrum repair. We've now finished our interportal capsulotomy. We've been able to do this both safely and quickly, and we have nice clean edges that we can approximate with our capsule closure at the end of the case to preserve the native capsule. Here you can see our final arthroscopic labrum repair. We have a 3 repair construct along with healthy cartilage and good clean leaflets with good edges to be approximated to repair our capsule for hip preservation.